Today we're going to be focusing on the sheep pluck, and the sheep pluck is going to include part of the respiratory system, but it's also got the heart with it, and it's also got the liver of the sheep as well on this one. So when we look at this, the first thing that you're going to notice the tube. This is the trachea. So the trachea itself is going to be lined with these ridges. Those ridges are that hyaline cartilage that make up those incomplete rings of cartilage. So they're C-shaped, which basically means on the posterior aspect or on the back, we're going to have this area here where those cartilage rings stop, but we still have tissue in between them. That tissue is that smooth muscle, the trachealis muscle. So that trachealis muscle is there basically to help with, if you're trying to cough something up, if you're trying to expel something, that muscle is going to contract and basically tighten the airway a little bit in order to get some of that stuff out of your trachea. The other thing that's important is because the esophagus is actually attached behind it, what that'll do is it will allow for, if you swallow a large piece of food, if it pushes forward into the trachea, that smooth muscle has a little bit more give to it than the cartilage does. So the cartilage itself, the whole point of it, you'll notice this tube is open. I'm not pressing on it, I'm just lightly holding it. And so essentially it's just allowing for that airway to remain open. So looking at the rest of the sheep pluck, the first thing I want you to notice is we do have the heart. So we have this pericardial sac. If you remember, the pericardial sac is the pericardium. It's the sac around the heart. So it's got a lot of fat on it. So that's the first thing. So that's going to be our heart right here. And then what we also have is, remember, we have the right versus the left lung. So the area that we're looking at right now is the anterior aspect. So this is the front. And so what we have are the lungs kind of have more lobes to them, and they're not as smooth as if we actually flip this over and look at the posterior aspect. If you look at the posterior aspect, the lungs are just a lot more smooth on the posterior aspect. So when we're looking at the lobes of the sheep, remember that we're going to have fewer lobes on the left. And the reason we're going to have fewer lobes on the left is because we're going to have, in general, the heart in that area. So the left lung is always going to be slightly smaller. So you'll actually notice that I'm kind of pulling on some of the lung lobes themselves. So on this one, you've got this upper lobe, you kind of have this middle lobe, and then you have this lower lobe. So on the sheep, we've got 3 lobes on the left. On the right, remember, we're going to have a few more. So the first lobe that we have is this large lobe at the bottom. So this cut right here is a cut. It is not a separate lobe. So we've got this lobe here, we've got another one here, and then another one here, as well as a fourth here. So what we have is we've got 4 on the right and 3 on the left when we're talking about the sheep lungs. The other thing that you can kind of note as you're looking through and going through this is that there's a lot of fat around the trachea itself, but at some point that trachea is going to split into the main or the primary bronchi. And you can kind of feel it better than you can see it as I'm dissecting this out. So around here, we have one that's going to the left, and then on the other side, there's a tube that's going on the right. So here is kind of where it splits. So that's where those main bronchi are going to go. They're then going to go further into the lobes. Once they go into the individual lungs, they split again into the lobar bronchi. And the reason it's called the lobar bronchi is simply because it's going to each one of the lobes in the lungs. From there, they're going to split into the segmental bronchi. And from the segmental bronchi, they're going to continue splitting until they get to the terminal bronchioles, and then they're going to turn into our respiratory bronchioles, which will then give rise to some of the alveoli. The alveoli are where gas exchange is going to occur, and those tend to be, because your tubes go through your lungs themselves, the alveoli tend to be kind of along the edges, but because there's so many of them, they take up the majority of the lung space. So as you move from the trachea on down to those terminal bronchioles, what will end up happening is that you'll have less and less cartilage as you move further into the lungs, and you'll actually get more and more of that smooth muscle that you see in the bronchioles inside the lungs.